Welcome to another edition of Focus on Performance. Today I'd like to talk with you about your revenue cycle management. The complexity of managing the revenue cycle has never been greater than in today's healthcare environment. From the economic impact on an organization's bottom line to the continued advancement of healthcare reform, the need to stay 3 steps ahead has never been more important for your organization's financial health. How do you approach declining reimbursements without impacting quality or strategic initiatives? Do you have the right talent or are market conditions forcing you to think differently about the revenue cycle? Not easy questions to answer. So how do you approach those questions? Business intelligence, for example. It's not just a term for reporting, but applies to the overall approach to your revenue cycle. Using business intelligence, you can evaluate the areas that have the greatest impact to your cash, like denials management and follow-up. As you examine these areas, business intelligence will begin to draw a picture with areas of concern. You may come to realize that outsourcing portions of your revenue cycle might be an option. Outsourcing does not mean giving it all away. It means scaling up and scaling down components of the revenue cycle. For example, converting to a new billing system is going to impact AR and denials, no matter how good you are. You cannot install and manage the old AR at the same time. You need to look at what makes good business sense for the organization, especially with regards to denials management, and ultimately, what's good for the patient. Can you financially support growth if your cash flow is being impacted? Cost pressures from staffing and IT are all having dramatic effects on the providers, not to mention ICD-10. The implications of ICD-10 on the billing process itself are staggering with regards to workflow, IT systems, reimbursements, and so on. Documenting the clinical process correctly has never been more important. We'll dive deeper into your revenue cycle challenges in our next segment. Thank you for joining me today for Focus on Performance. I look forward to seeing you here again soon. In the meantime, contact us today to find out how we can deliver full spectrum financial health to your organization.